Alright, so this video is going to cover using ultrasound in order to do phonophoresis. The goal of the modality is to alter skin permeability and alter the pore size within the skin in order to enhance the delivery of topical drugs to a localized area. One of the main benefits of phonophoresis compared to orally ingesting an anti-inflammatory medication is that the phonophoresis allows a very localized treatment, while the orally ingested medication will produce a more systemic effect. Some of the common drugs that are used are hydrocortisone and dexamethasone, which are both anti-inflammatory medications. And then the overall process, we just place the medication on the area that we want to treat, and then we are going to use a medium such as gel, put the gel on top of the medication, and then we are going to use the ultrasound head in order to work the medication into the skin. Just in general, we want the parameters to target a non-thermal superficial treatment, so something like a frequency of around 3 megahertz, an intensity around 0.5 to 0.8 watts per centimeter squared. And then we are going to set our pulse period to 20%, and we're going to treat the area for 6 to 10 minutes. Just a general precaution, we want to notify the patient to not take any anti-inflammatory medications orally while we are doing phonophoresis during their treatment. And then general precautions for ultrasound. Don't do it over epiphyseal plates, fractures, breast implants, impaired circulation, and impaired sensation, impaired mentation. And then contraindications of ultrasound include malignancy or tumors, pregnancy, central nervous system tissues, over joint cement and plastic components, over pacemakers, thrombophlebitis, and over the eyes or over reproductive organs. All right, we have our patient Brett here, and he has some inflammation in the medial side of his elbow near the common flexor origin. So we're going to use phonophoresis and ultrasound in order to enhance the delivery of a topical med, dexamethasone, in order to reduce the inflammation in the local area. So what we're going to do first is we would set the parameters, like I said earlier, around 3 megahertz, anywhere from 0.5 to about 0.8 watts per centimeter squared. We definitely want to use a pulse setting at 20%, and then we want to do the treatment for around 6 to 10 minutes. So what we would do first is we would put the medications on the medial side of the elbow here, and then after we put the medications on, we would put on the ultrasound gel in the area, and then we would just continuously move the ultrasound head in order to prevent any thermal effects. There should be no thermal effects, but moving the ultrasound head will prevent any of that from happening. And then we'll just work the medications into the medial side of the elbow here.